Most of the tumors in the spine are secondary to tumors elsewhere in the body. They spread to the spinal column and compress the spinal cord and give symptoms. Most of them have night pain, breast pain, difficulty walking, and other neurological symptoms, bowel, bladder incontinence, all those. So depending on the spread of the tumor, how far it has spread in the body of the patient, and what is the aggressiveness of the tumor, we can give, and depending on the sensitivity of the tumor to particular mode of treatment, whether it is radiosensitive, chemosensitive, or need a surgical treatment. So we can plan the treatment accordingly. When it's a very widespread tumor with a spinal cord involvement and neurological deficit, we can do a palliative decompression so that if it improves the quality of life of the patient. Nobody can exactly predict how long a patient would live. So it's an arbitrary period, but what matters is the quality of life. How long? If you live for 100 years like a slave, that doesn't mean anything. But if you can live for 1 year like a king, that's the quality of life. So rather than being in bed paralyzed with the sores and everybody with a sympathetic look, if you can be up and about and walk around and do your own needs yourself, that's the greatest blessing. So a procedure that would help in becoming, for a patient to become in that way, that should be done. It shouldn't be forbidden for the patient. Whoever propagates any negative thoughts for any particular modality of treatment. We have so many examples that patients who were told that they will be bound to the bed till the rest of their life, with the proper procedure and surgery when it was indicated, made them recover from all the illness, and they are walking freely for years together, doing all the jobs by themselves, and finally the patient dies of cardiac arrest or heart attack rather than dying from the tumor. And there are many examples, patients who get massaged without any proper evaluation and getting paralyzed. These patients, they can do a simple massage, but when there is a significant symptom, it's better to evaluate with the proper diagnostic tests and then go for massage if at all needed. Otherwise, take the correct treatment so that your life is saved.